Hi, I'm Dr. Ashish Dutta. I'm a cosmetic surgeon at the Aesthetic Beauty Center. Thermage is a non-surgical skin tightening process. It is a radiofrequency machine which sends the radiofrequency into the skin and thereby tightening the skin. It is a heat process, so we try to cool the skin down so that the damage to the skin is minimal, and as the skin tightens over the next 3 to 6 weeks, new collagen is deposited, which is called neocollagenation, and the skin looks fresher and hopefully much tighter than before. Traditionally, skin tightening involved surgical procedures like a facelift or a blepharoplasty, where we took a certain amount of skin, tightened the internal structures, and the patients looked fresher. However, modern day patients do not want the downtime or the scarring. Thermage is such a treatment. We deliver a quantity of radiofrequency into the skin. We cool the surface so that the skin doesn't get any damage or any burns, and this radiofrequency then delivers that energy into the deep dermis where the fibroblasts are. These are the cells which produce collagen, which makes the skin look fresher and softer. The effect of Thermage lasts from about 18 to 24 months, but it varies from patient to patient. It depends on what the quality of the skin the patient has. In younger people, it can last up to 2 to 3 years even. The collagenation that happens in the skin usually stays in the skin for up to 18 to 24 months, and the effect also continues up to that time. As I said earlier, the effect is visible between 6 to 12 weeks after the treatment. So what I tell my patients is observe how the first treatment has happened or what effects the first treatment has produced, and then decide on whether they need a further treatment or not. About 20% of the patients need a second treatment at about 6 months, but most of my patients will come back in about 2 to 3 years for a second course of Thermage.